By the conclusion of my speech, I hope to inform and persuade the audience as to the numerous health-related and associated pitfalls associated with smoking. Often smokers think that the risks of smoking are limited strictly to their physical health problems, when in actuality, smoking affects us all. Although every able-bodied adult in this country is aware of the dangers of smoking, it is alarming to note that roughly 40 million people in this country continue to smoke. Of those 40 million, roughly 23 million are habitual smokers that smoke every single day. Although the number of smokers in this country has declined over the past 4 decades, it is alarming to note that although we know the damages of smoking, the number still remains relatively consistent. Also alarming is the fact that every day in this country, over 3,000 adolescents become new smokers. If we're aware that smoking is so harmful for us, then why do so many people continue to do so? If we're aware that every day a high number of adolescents become new smokers, why have we not done more to prevent that? Today I hope to illustrate the associated health risks with smoking, the risks to family members around the smoker, some financial downfalls of smoking, as well as how it affects our society. I will attempt to inform and persuade you as best I can as to truly how harmful smoking can be. Now that we've discussed some of the background and numbers associated with smoking, let's look at some of the health risks directly related to the smoker. The Centers for Disease Control and Prevention have described tobacco as the single most important preventable risk to human health. Having said that, it is estimated that over 400,000 deaths in this country every year are directly related to smoking. Each year, this country spends roughly $97 billion on healthcare. And of that $97 billion, a sizable portion goes directly to smoke-related health issues. Smoking, as we all know, is cancer-causing. Some of those cancers that are directly related include lung cancer, cancer of the larynx, cancer of the mouth, and even chronic obstructive pulmonary disease, or COPD. Now that we've discussed some of the health-related problems directly related to the smoker, let's look at some of the problems that affect those around you. Secondhand smoke can also have numerous health risks to those around the smoker. Secondhand smoke is a known human carcinogen and contains more than 50 chemicals that are known to cause cancer. Some of these carcinogens and toxic cancer-causing chemicals are potentially higher in the secondhand smoke expelled from a smoker than the smoke that smoker intakes themselves. So the smoke around the individual is actually more harmful than the smoke than the actual cigarette to that smoker themselves. In addition to causing lung cancer, there are numerous other health-related risks to individuals around the smoker. Secondhand smoke is also directly related to respiratory disease. Sudden infant death syndrome, or SIDS, is also a health-related risk to those around the smoker. Children that live in a home with a smoker are more likely to develop asthma. And if you live in a house with a smoker, you are 20 to 30% more likely to develop lung cancer than if you didn't live in that house at all. Now that we have a better understanding of the health-related aspects of those around the smoker, let's look at some of the financial aspects that involve smoking itself. Today in America, an individual who smokes can pay anywhere from $5 to over $10 a pack of cigarettes. If cigarettes were to cost you $5 a day, if you smoked 1 pack of cigarettes every single day, at the end of that year, it would roughly cost you $1,825 to smoke. If you lived in an area where they were $10, you're looking at over $3,000 a year to smoke. Over a lifetime, an average smoker at that rate could even purchase a second home. Right? In the past 10 years, the price of cigarettes has increased over 200%. And every year, this number and the taxes on cigarettes drastically increase. The amount of financial problems associated with smoking are numerous, and for those to quit and put that money elsewhere could be of good benefit. The bulk of smokers themselves make up the middle and lower class of our society, who already struggles with financial problems, and this is just adding one additional one. Now that we've discussed some of the financial aspects associated with smoking, let's try and recap. Today I've done my best to illustrate that the problems associated with smoking affect the health of the smoker, affect the health of those around the smoker, are financial burden to smokers themselves, and in society cost us billions of dollars annually in healthcare. I hope that having heard this, you have a better understanding of the damages smoking can cause to you and anyone else around you. Hopefully, after hearing this speech, you might be able to better assist someone to quit smoking, prevent someone from ever starting, and more importantly, to prevent our children from continuing to do so.